We are here to talk about reflux disease. So let me introduce myself. I'm Dr. Madura Prasad, a consultant gastroenterologist of VGM Hospital, Coimbatore. So reflux disease, it's the price we pay for this modern lifestyle of ours. So what is it? Here's the esophagus, the food pipe, and the stomach. Between both is a valve which is supposed to stay closed and allow food to go in, but not allow the acid and the food to come up. So when this mechanism fails, that is when the reflux comes. So how does the patient recognize reflux? Patient develops a chest discomfort or a heart burning sensation. But keep in mind that it could be cardiac. So the first thing to exclude with the chest pain is cardiac. So once it's done and you feel that the food reflux is, the chest pain is related to food, then you know that it's reflux related. So the other things which can happen with reflux, belching and throat pain, frequent clearing of the throat, a very chronic dry cough, some middle ear recurrent infections, dental problems, sinusitis, and even snoring and sleep apnea. These could all mean reflux. So what do we do when the patient has reflux? We check in 3 different ways. One is the history itself, the patient saying that it's related to food and there's a burning sensation, and then we go for the tests. Then you could undergo an endoscopy, and endoscopy will show the valve very loose, and sometimes there might be even a hiatus hernia there. And the next thing is the impedance pH-metry, which detects properly how much of acid and how much of non-acid comes up into the esophagus. So what do we do when this happens? The main thing is lifestyle changes. So what is the cause? First you have to know about that. So the main cause of reflux is obesity, smoking, alcohol, having a lot of caffeine. And then some medications can also trigger reflux. After all this is excluded, there are many people who still have reflux. It could be genetic, hereditary. So ultimately our lifestyle changes are going to help a lot. So the main thing is after dinner or before going to bed, there should be a gap of 3 hours so that the food doesn't come up and the food has gone into the next part of the intestine. The next thing is elevate the head end of the bed slightly, just tilt the bed up. That's one thing which helps. And avoiding caffeine, exercising regularly, even if you're not able to lose weight, even the regular exercise helps. But if you lose weight, it will really help and reduce the reflux. And avoiding smoking and alcohol. Beyond this, if you still have reflux, then it's medications which you require. And then the next step is surgery, which is the ultimate treatment for reflux, where we tighten the valve. And now, latest techniques of endoscopy is helping, where endoscopically we can tighten the valve. So now you are an expert on reflux.